Welcome to Day 2 of the 2020 National Runaway and Homeless Youth Grantees Training. Please welcome to the stage Risa Matthew, Director of the Division of Adolescent Development and Support at the Family and Youth Services Bureau.
So good afternoon, everyone, and welcome to this year's General Federal Session. We have a lot of pertinent information to share with you, so we will get started. Next slide. Next slide, please. And so as I was introduced, I am Risa Matthew of the Family and Youth Services Bureau, and I serve as one of two directors in FYSB. And so for those of you that are new to RHY, my division is the Division of Adolescent Development and Support. And so I serve as the director for our Adolescent Pregnancy Prevention Program, as well as our Runaway and Homeless Youth Program. I'm also joined for today's presentation by my colleagues who serve as managers for the RHY program. This includes Chris Holloway, who is the Central Office RHY manager, and three RHY managers who are in the regions, Aaron Kelvington, Keith Wallace, and Jeff Daniels. Next slide, please. And so today we have a packed schedule of information to share with you. So we'll provide you with some RHY program updates. We will share a little bit more about the TLP Youth Outcome Study that is underway. We will then share some RHY products and some data from RHY HMIS. We will then talk a little bit more about our TLP Permanent Connections Study, share with you some RHY program monitoring to include some of the trends and insights. And then, as many of you know, we've been adding new staff to our RHY team, so we'll provide you with some updated RHY team information so that you're able to see who your federal project officers are, as well as who your regional program manager is. So next slide. And now I'm going to turn it over to Chris Holloway to provide us with some RHY program updates.
Thanks, Risa, and welcome to everyone. I hope that you are enjoying the training. I've seen lots of positive comments coming up in the chat feeds. I visited most of the workshops over the past few days, and seems to be great attendance. So I really am appreciative that everyone is taking advantage of the opportunity. So we're going to move on. I'm going to give you a few updates here on things that you can expect in the next coming months, as well as some things we've been working on here in the Family and Youth Services Bureau. So we can move to the next slide. So just for those of you who are joining us and are not particularly familiar with the Family and Youth Services Bureau, we do sit in the Department of Health and Human Services in the Administration for Children and Families. Hopefully you had a chance to listen to Commissioner Darling on Tuesday for the opening plenary session, and she serves as the Commissioner for the Administration on Children, Youth, and Families. Then she's also serving as our Associate Commissioner for the Family and Youth Services Bureau. During our opening plenary, you met Debbie Powell, who is the Deputy Associate Commissioner, and we're currently operating under two divisions, the Division of Adolescent Development and Support, for which Risa Matthew, who you just heard from, is the Director, and then the Family Violence and Prevention Services Division. We've got workshops made available for adolescent pregnancy prevention in the We Think Twice campaign, and there was a specific workshop that was sponsored by the Family Violence Prevention and Services Program during this event as well. Let's go on to the next slide. So hopefully you know that the Runaway and Homeless Youth Program has three primary areas. We deal with runaway youth, we deal with homeless and or street youth, and we provide services to pregnant and or parenting youth through our Basic Center, street outreach, transitional living, and maternity group home programs. Moving on. So we had a lot of activity in fiscal year 20 that provided us lots of active awards. We have now more than 658 grants to more than 300 organizations. Some of these are active awards as a result of carryover because of the CARES Act money, if you received any of those funds. And you can see here the breakdown of the number of runaway and homeless youth grants that are currently active. Now, I know each year this is a particularly interesting event for most of you who are looking to apply for funding in the up and coming fiscal year. So we want to make sure we provide that information to you. If you go on to the next slide. So what can you expect in fiscal year 2021? If you haven't already seen our forecast announcements, we anticipate a street outreach program funding opportunity announcement, or FOA, where we'll make approximately 34 awards. There'll be another round of basic center program funding, looking to award about 81 new grants. Moving on to the next slide. We have transitional living back this year and a separate maternity group home funding announcement as well. And because these funds come from the same appropriation, we're putting roughly 12 million, 11.9 million for the TLP program and a little over 5 million for the maternity group home. These are $250,000 max awards this year, and they are a 5-year budget and project period. We're moving back to that length of time. Next slide, please. So just a few bits of information. For those of you who aren't aware, we've been working behind the scenes on the TLP Youth Outcome Study. We have 30 grantees from across the country who have volunteered to participate in this research. We're looking to enroll more than 350 youth, and we're almost there. As of November 4th, when this data was provided to us, we had 220 youth who are already participating, and we have the entire month of December and the remaining of November to reach our target goal of 350 youth. And on the next slide, you'll see some of the things that we're hoping to accomplish. We want to determine whether or not the youth who have been involved in the TLP program have made gains, in education, employment, and housing, and whether or not there's some sustainability after they've exited the program. We're also going to do some individual interviews with youth specific to COVID-19 in order to try to get their feedback on how it is that they've fared during these 6, 7, 8 months since the COVID-19 pandemic began. Hopefully we'll be able to have a final report sometime by the end of 2021, closer to the fall. All right, moving on. And this is just a brief map that gives you an indication of where all of our youth outcome study participating grantees are at. We've got a wide variety across the country, from Florida to Alaska, from California to Virginia and West Virginia. Next. All right, so I'm going to hand this back to Risa now. She's going to cover the RHY products and data. And I look forward to seeing you all again toward the end, where we'll field some questions and answers from the audience. Risa?
All right, thanks, Chris. And so I just wanted to take this opportunity to share a couple of products that are forthcoming, but to give you a snapshot of what's ahead, and then to share some of the data from RHY HMIS. Unlike last year, we listened to the evaluation comments, and so I'm not going to share as much data as I did last year, but just a snapshot of them. So next slide, please. And so one of the new products that's forthcoming is the work that we've done in terms of conducting a lit review. I know that we've talked about the 4 core outcome areas, and we really wanted to take the opportunity to identify what are some reliable and valid measures specifically related to youth that's normed with youth or with youth experiencing homelessness. And so we've been working with one of our contractors and really to conduct a comprehensive but systematic review of the literature, focusing on the more recent journal articles and so forth on youth experiencing homelessness. And when we couldn't find a particular measure that's related to youth experiencing homelessness, it was with youth in general. And so again, You hear a lot more about the 4 core outcome areas. And so for those of you who are new, that is safe and stable housing, permanent connections, and we have a lot of workshops that focus on social capital, and then education and employment, and then physical, social, and emotional well-being. So next slide. So this is just one of the core outcome areas in terms of permanent connections, and actually this is taken from one of the pages in the compendium that we've developed. And we really wanted this literature search to focus on some major databases such as PsycInfo and PubMed and EBSCOhost, but we wanted to also limit it to 2 primary types of studies: epidemiological studies that really look at to discover what factors make homeless youth more or less prone to certain outcomes, and then intervention studies that test whether certain programs or approaches are likely to increase youth success. So next slide. So this is what the actual compendium looks like. So for example, this is one of the scales that's under permanent connections. And so it talks about the target populations it's normed with, excuse me. And if you double click, I should have said, if you double click on your screen, you can make the screens larger. It also provides a psychometrics for a particular tool if it's available. So we look at the validity and the reliability of those tools. I think for many of you who are data nerds, Cronbach's Alpha is one of the major model that talks about the reliability. It talks about some strengths of each of the tools or measures, and then any weaknesses. Next slide, please. And so at the end of each of the tools, there are a lot of key references that you can look at to get more information or to look at other journal articles as it relates to a particular tool. Next slide. And so this one is well-being and physical well-being. And I should mention that in Dr. Hellman's keynote address yesterday, he talked about the Children's Hope Scale, and that is actually in this section of the document once it's released. So next slide. And so this is one of the, I did not put up the Children's Hope Scale, but had I known, I would have chosen that before finalizing this particular slide deck. But again, similar setup in terms of this particular measure. Again, looking at who the target populations are, where it's been used with, the psychometrics, the weaknesses, strengths. And on the next slide, you'll see a similar process of having references. So we are in the midst of this particular document going through the approval process. And then once that has been finalized, we want to make sure that it goes through the 508 remediation process, and then we will disseminate it broadly to all of our runaway and homeless youth grantees. Next slide. So wanted to share some RHY HMIS data and to share a lot of the work that you're doing, and really want to commend all of our grantees in terms of being able to not just work with youth, but we do appreciate the time and effort it takes to collect the data from the youth and then upload it through our data repository. Next slide, please. So this is the number of youth served by RHY funding type, and which makes sense. For the street outreach program, I just looked at number of contacts and not at number of engaged youth. And you see that there's a basic center emergency shelter and basic center prevention, our transitional living program, and a maternity group home program. And so I want you to focus on these numbers because this is total number of youth served by funding type. But as I talk about the data later, you will see that these numbers are not truly reflected in the data that I'm going to share with you. So next slide. So this is looking at the number of maternity group home. This is for maternity group home program, and we're looking at safe exit destination. And as I mentioned earlier, one of the 4 core outcome areas is safe and stable housing. So the one at the top left, as we can see, 95, and under the percentage column, 95% of the young people are saying that yes, they do feel like they're going to an exit destination that is safe. However, if you look at the right-hand side of the screen, again, this is as determined by the project or caseworker and what they're seeing in terms of safe and appropriate exit destination, and that's 85.3%. So we're doing really good with that. What I want to highlight, though, is the missing data. So if I mentioned to pay attention to the slide before, for example, there were 528 young people served in the maternity group home program, but under the total youth who've reported, you only see it's 291. And so we have about 237 cases that are missing, which is roughly about 45% of programs have not reported on this. Similarly, it's about 45% exit destination as determined by the project or caseworker. So the percentage that I've included here adds up to 100% because I've only included the valid percent, meaning for all of those who did answer this question. So next slide, please. And here it is so I did it for maternity group home and I've done it for the transitional living program. Similar situation, we're seeing that 91% of the young people are saying, yes, when I exit, I'm going to a safe destination. And it's about 76% for the project or the caseworkers. Here is where I think we missed the mark in terms of missing data. And so it's about 58% of the data are missing because when I looked at the number of youth served by the program for TLP, it's 4,229, but we only have 1,765 cases to report on. And similarly for the project and caseworkers. So we are doing really good in terms of making sure youth are going to a safe exit destination. But I think we need a little bit more work in terms of the ability to provide data. Because as I shared on Monday in one of the pre-institutes, the goal of the data is to share it with each of you as grantees. We share it with our federal project officers as well before they come on site for monitoring. But we also have a legislative obligation to report these data to Congress. And so this is the opportunity for us to be able to share with a full case and not have as many missing data to say that we are doing really good work. And so I do commend you in terms of the data that's here. And so next slide, I'm going to share a couple more pieces of information related to permanent connections. I think a lot of the workshops I've seen focused on social capital, and we'll hear a little bit later in this session about our TLP permanent connections. But just to know that roughly about, and this is, if you look at the bottom, it's BCP emergency shelter, and we can see the number of youth who are saying they have a permanent positive adult connection outside of the project. And I specifically chose this particular one for the adult connection, although in our data standards for RHY HMIS, we do look at permanent positive peer connections and permanent positive community connections. So next slide. And here it is for our basic center prevention program. And we see that a high number of youth are saying yes, once when they're in the program, they do have a permanent, a positive adult role model in their lives. And I'll just run through the next couple of slides because they're for, next slide, I believe, is TLP and then MGH. So here it is again, 80-something% for our transitional living program, where they do have a positive adult in their lives. And then next slide. And here it is for the maternity group home, I think, which has the highest number. So just wanted to, for illustrative purposes, to show what some of our data are stating. And I put the percentages here, not the actual numbers, because it's a similar situation with missing data. But this is based on the valid percent of those who did respond to this particular item. Next slide. So what I want to share is a little bit of updates about our RHY HMIS data standards, and then share some resources with you. So next slide. So for the Basic Center program, I know many of you know that it's a requirement or a legislative requirement for us to have a Basic Center shelter program. The prevention or home-based program is optional. However, there's now the possibility that you could possibly have up to 3 project setups in HMIS for the Basic Center program. It's still 2 categories: Basic Center prevention and Basic Center shelter. However, for those of you that do have a host home under Basic Center shelter, you can actually have your project set up for host home, as well as if you have congregate care. So just wanted to highlight that as one of the changes that happened for 2020. And then one of the challenges we're seeing with our data upload process is to make sure that your grant ID number is correct and corresponds to your funding type, so that you do get credit for your data upload. TLP grants usually start with 90CX, Basic Center has CY, and Street Outreach has YO. So I think those are critical pieces to make sure you are getting credit for the data that you're uploading. And then the last thing I wanted to highlight in terms of data standards is that prior living situation has now been replaced both residence prior to project, which was data standard 3.9, and length of time, which was 3.17. And then I think this was highlighted on Monday in the pre-institute, but beginning in 2021, data uploads will be occurring quarterly. So this year we have a new contractor, and so we did not have a spring data upload this year. We had the one in September for those grantees that were ending in September, and then we had the second one in October that just ended this week, actually. So in spring of 2020, we'll have the regular spring data upload, and then we'll be doing that quarterly. And so for that, I think 2 things that I want, or 3 things: prepare, prepare, prepare. I think that doing it twice a year may have posed some hardships on a lot of our grantees to try to be able to remember and be able to process the data and work with their HMIS lead to extract their data through the CSV and be able to upload that. So moving to a quarterly data upload, I think, will be helpful to a lot of our grantees. And so looking forward to hearing how that goes. So we're trying that to see if that works in terms of having higher data quality and less missing data. Next slide, please. And these are just some of the resources. I think that was also shared on Monday. We have an RHY HMIS manual that walks everyone through all of what we call the universal data elements that all grantees who are, or all federal partners who are in HMIS have to adhere to. But then we also have our program specific ones, and it will walk you through which data elements are needed for BCP, TLP, and Street Outreach. We also have an updated RHY HMIS frequently asked questions. We developed it in 2020, and we've worked to update that. And then there's an RHY HMIS data collection and reporting user guide that I think is very critical in terms of we're helping you with your data collection as well as uploading. And then there is a space or page on RHYTAC's website that is dedicated specifically to just RHY HMIS. So RHYTAC is another source for some of the resources that exist for you. And so we do have some instructional videos, the manuals on there, the frequent questions, the data collection, and so forth. So next slide. And I am actually going to turn things over to one of the program managers, Erin Kelvington.
Hello. So in the next few minutes that we have remaining, we're going to talk about what we've been doing at the programmatic level, how we're adjusting to the impact of COVID, as well as the work that we're hearing or what we're learning and seeing from the work that you're doing. Next slide. So just real quickly, a kind of an overview of the past year. Since we last met, some key highlights that the RHY program staff have been working. And I really want to highlight, as you hear me say we, I'm really, that we is the majority of our program staff, your federal project officers out in the field, the work that they're doing. And so as we'll talk a little bit more about this Permanent Connections project study that we started. We were able to do a handful of on-site monitoring reviews. And then COVID hit, right? And our world got turned upside down. And so in that process, those 8 months, we came out with some and developed and disseminated information, memorandums, flexibilities around the services and the provisions and the use of the funds, frequently asked questions in regards to program-specific components. And then we were fortunate enough to have the CARES Act passed, and our RHY program specifically received $25 million to disseminate that across our 600 plus grant programs. Also during this time frame, our project officers, your project officers, we've spent thousands of hours connecting with you, talking with you. Discussions are in and around, operations and management of your program services, kind of learning from you again and hearing from you as far as how you're adjusting, facilitating those processes, and again, working with you and developing a plan to use the CARES Act funds to, again, address the needs of the COVID impact, preparing and responding to those needs of the youth. Here recently, as we entered in this new fiscal year, the FPOs have been working with you again on those that had any remaining dollars from the COVID supplemental CARES Act funding, again, to address that and how to use those here in this next year. Next slide. So in 2019, late fiscal year 2019, we were able to set aside some funds and develop a funding opportunity that would address and promote and strengthen permanent connections, creating an opportunity there where established transitional living programs could apply and develop some programming that would strengthen the whole process. Next slide. So in that process, it was, I think I mentioned already, about $500,000 that we were able to set aside that enabled us to fund 5 projects. These are the 5 organizations that received that award. And it is so each grantee received $1,000 for a 24-month project period to 12-month budget periods. Next slide. So project expectations. This is really essentially the primary goal of this project is to advance the permanent connections and aftercare support for youth in the TLP. We know that through data, through research, through our conversations with you, one of the biggest challenges and perhaps gaps has been in the aftercare process. I've spoken with many of you in this area, and the attention that you're placing on them while they're in the program is phenomenal, and they establish and connect, and engage with you. And then when they leave, they're out there on their own, and they tend to call back again when life happens, right? Well, we wanted to look at how do we teach that permanent connection piece of it? How do we really instill in our youth that ability to be successful when they've left the program? So we're really interested in bridging that gap between the support that they have while they're in the program and then the positive support system they need to establish and develop and maintain after they exit as a resource for their own success. We're also interested in strengthening proven interventions that help build those relational skills and abilities that contribute to healthy functioning and positive, productive transition of youth into adulthood. We want to build, strengthen, and leverage collaborative partnerships. We all know that this takes a village, right? So the staff work that we're doing on the front end while they're in our care, and those partnerships and collaborative efforts in the community that you're leveraging and connecting them with enables them then to transition and maintain that and continue to grow in their goals. Next slide. So the project description, like I said, there was 5 organizations that we selected and awarded. 3 of those are using a group mentorship model, and 2 are using a peer-to-peer or individual contact, a person who's following them individually throughout the process and in that mentorship type of model. So if you think of it in the context of your contact list from your phone, right? You have people that you can depend on, people that you can call on in the middle of the night when it's raining and you have a flat tire and you know that they're going to come out, they're going to help you, and they're going to do so without any expectation of being reimbursed. And we know that our youth don't have that. The youth that we're serving and working with have tended to be in circumstances where when they need help, there's always something attached to that. It's what are you going to do for me? And that's obviously an unhealthy dynamic that we want to break and encourage folks to, and our youth to be able to establish and identify who are some adults, who are some peers, who's some community linkages that they can get connected to that will help them address life as they move forward in a positive way. So it's really about helping you build those close relationships with local respected individuals, professionals, community leaders, and establish a network of support. Next slide. So we're hoping to learn, as I kind of mentioned earlier, what we're interested in. This is really a study project. So in order to study it, we have to have individuals that have gone through the process and we've learned from those experiences. But really the meat of this is we're hoping to learn, how collaborative partnerships have strengthened and improved through this process, your networks organizationally, the community networks, the community impact that you're having, that capital engagement, community engagement capital, and how permanent connections and aftercare support for youth increasingly then leads towards achievable successes in the 4 core outcomes. The 4 core are, safe and stable housing, education and employment, social and emotional well-being, and of course, permanent connections. Next slide. So COVID hit. And, that really put a stranglehold on being able to initiate and walk out this project, with many of the grantees struggling with that. This is a social, interactive engagement project, and when you have to have social distancing, when we're isolated and we're not able to leave the house, when work begins to impact that, when the ability to seek out a safe and stable housing, right? All of those types of things have been impacted in this. So it's been a very slow process to get to that. And so really in this first year, the focus and the purpose was to look at the implementation piece of it. What is the model that you're using, and how are you implementing that piece of it? We're not really looking at outcomes at this point. We want to see this project and the approach that you've instilled. How is that working, and how can we have a a contractor that we used to help with TNTA, to help with guidance in developing measuring tools, and also to support in the models that you're working with to strengthen that process this first year. I'm looking forward to next year when we meet again, and hopefully it will be in person, to discuss the more so the outcomes of this and how we can build from this process in future funding programs and in future programs overall within the RHY youth that we're serving. Okay, so that's my piece. If you go to the next slide. Okay, and I'm going to turn this over to Keith, and he's going to talk a little bit more about, again, what you see there, monitoring enhancements and our trends. Thanks.
All right. Good afternoon, everyone. So glad we were able to get together virtually as opposed to not at all. Hope everyone's staying safe, doing well. Want to talk to you briefly about the monitoring enhancements, especially since COVID has definitely put a damper on how many site visits we can do. First of all, monthly grantee contacts. For those of you that are long-term grantees, you've noticed that we've gone to a new procedure where every other month we actually have a group call where all of the grantees in a region will meet with their federal project officer, and then on the off months, it's a one-to-one contact. Validation visits we've been able to formalize, and what a validation visit looks like is after you've had an on-site monitoring visit, or in the future, a virtual site review. If there are any compliance issues found, then later on, once those compliance issues have been resolved, the federal project officer will make plans to come back and visit your site. And this is just to validate that all of the concerns have been corrected and that everything is flowing as it should. And then here in a little bit, we're going to have Jeff Daniels speak to you about virtual site visits. Next slide. So 2020, we did get some trends and insights. Some of them are new, some of them not so much. But the trends were developed as a result of on-site monitoring visits and monthly grantee calls, both the individual and group calls we just discussed. For FY2020, our federal project officers were able to complete 9 on-site monitoring visits before the pandemic prevented federal travel. And in those, as you can see on this screen, 4 of those were to basic center shelter programs, 5 to transitional living programs, 1 to a maternity group home, and 2 to street outreach programs. I realize those numbers don't add up to 9, but that's because some of the grantees have more than 1 RHY program. Next slide. So I want to run through some positive aspects, best practices that we saw trending this past year. For emergency preparation, planning, and response, use of Zoom for case management with program youth, drop-in centers that were deemed non-essential businesses in some cities were able to get a temporary license as a shelter and provide care to RHY youth that were diagnosed with teen. Others arranged drop-off areas to meet youth and provide gateway services, which of course includes food, water, clothing, socks, hygiene kits, etc. For sustainability, daily check-in with program staff to focus on their well-being, and then offering virtual support groups for staff to enhance self-care have been established and are doing very well. Youth action boards. Grantee created a youth leadership development committee so that peers in their RHY programs are actually speaking directly to other youth regarding COVID safety, such as wearing masks, washing hands, social distancing. In community networks, the use of constant contact, social media, email blasts, and then local news sources were used to engage in virtual networking with stakeholders and other community organizations. Programmatically, access to health screening and care. One agency in particular utilized partnerships with local clinic to offer weekly testing of all RHY youth in their programs, and then also engaged in telehealth case management using Zoom. Apprenticeship and training, virtual job readiness has been implemented to prepare youth to enter employment once businesses are able to reopen in one of our grantees. And then comprehensive data tools. One of the grantees is tracking locations where RHY and street youth are known to congregate and what specialized needs have developed during the pandemic, specifically need for hand sanitizer, mask, and gloves, plus access to COVID-19 testing. Next slide, please. So for non-compliance issues, what we have seen Fiscally, need to ensure RHY expenses are allowable, they're properly tracked, and then supported by documentation. Training and staff development, which are very important, and as Aaron was speaking on the core training requirements, some are not being completed or they're not being documented in the personnel files. Programmatically, RHY eligibility, we have issues where some youth being served are not eligible for RHY services, or there's a lack of documentation showing that the youth was eligible in their file. There's been a lack of individualized service plans in some cases where a youth file is missing the required service plan. And in some instances, we had life skills that grantees were not offering that are required, or they were failing to document those plans in the youth files. And then lastly, aftercare is provided for 90 days after a youth exits a program, but this wasn't always being offered or they were not documenting these services in the youth file. Next slide, please. So what's trending for opportunities for improvement? HR management, ensure personnel files have all required documents to include up-to-date training files and the required background checks. For community engagement, ensure your staff are engaged with other community organizations and documenting those efforts. Comprehensive assessment and case planning, ensure that intake and assessment service plans are all being performed on RHY eligible youth and documented in the youth file. And then documentation, social work 101, if you didn't document it, then it didn't happen. Please make sure you document. Life skills curriculum, be sure you're using evidence-based curriculum and documenting that in the youth file. Same for recreation and leisure activities. Have a formalized recreation plan and a calendar and engage your youth in developing those plans. And then lastly, aftercare and safe exit. Make sure you're providing those aftercare services, have an aftercare plan developed for each youth, and then document those services in the youth files. Safe exit should also be documented. Next slide. So creative solutions for providing services, the self-care check-ins for staff we discussed. They launched targeted communications to both youth and staff and stakeholders in their communities. Drop-in centers, some have used pop-ups in parks where instead of the actual building, they're actually going into the areas where youth are known to congregate and providing the services that are necessary. One program even put in a drive-through type walk-up window in their kitchen so that youth could come up and get food and hygiene items and other things that they needed. And then in street outreach, an increased social media presence has been very effective. And then contactless resource packs where the items are put together and then they're put out for the youth to pick up without actual having physical contact with staff. And then health screening site locator maps have been very helpful. Next slide, please. So creative solutions, basic centers, they've engaged in virtual and remote learning, professional cleaning of the facilities, quarantine areas being added, and immediate access to telehealth have all been very successful. And then for transition living, maternity group homes, having virtual case management using Zoom and other platforms, and then for youth to be able to access and monitor youth well-being through these same sources have been very effective. I just want to say grantees have done an excellent job of thinking outside of COVID-19 and ensuring that RHY youth continue to get the services they need, and for that we thank you. And next, to discuss the virtual site visits in more detail, I'm going to turn this over to my colleague from Denver, Colorado, the Regional Program Manager for Regions 8, 9, and 10, Mr. Jeff Daniels.
Thank you, Keith. Really appreciate that. And welcome everyone. I know you've been here. Just wanted to give you an idea. We're wrapping it up. Just a few more slides here, so hang on with us, and we'll try to get your question and answer session here shortly. But what I wanted to do is I want to provide a quick overview of what we're planning on doing to really address the issue when it comes to on-site monitoring visits. What we've done is we've created the virtual site reviews, which we refer to as the VSR. And as you can see there, it's really just an alternative approach to an on-site monitoring visit. We've had several questions, I know, about this particular format and platform. What we want to do, just to give you all sort of a little initial information, is that we're planning on using the Zoom format in our virtual site reviews. And one thing we're doing is we're planning 3 pilot virtual site reviews. We want to get those completed by the middle of December. And don't worry, If you haven't been informed already, then you are not going to be a pilot of VSR at this point. What we did also plan on doing, and you will be being in touch, or your federal project officer will be in touch with you. We're planning 7 additional VSRs, which we hope to occur prior to the end of February 2021. Next slide, please. So really, this kind of gives you an idea of what we're looking at. We want to give you an idea of who the participants will be for the VSRs. We do plan on having, obviously, the federal project officer, a peer monitor, along with, and these are the pilot VSRs, the regional program managers as well. Additionally, we plan on having a contract representative who will be in observe-only mode. So they will not be The idea behind that is to provide some continuity amongst the 3 pilot VSRs so that we can help to enhance and improve the process prior to launching the remaining 7 virtual site reviews. Next slide, please. Okay, so what I want to explain to you is that the virtual site visits at this time are not intended to replace the on-site monitoring visits moving forward. It's really a temporary solution that we're trying to provide you all with some on-site knowledge and information as we can do a site visit. But the intention, at least at this point anyway, is not to replace the on-site monitoring visit with the VSR. It's a temporary solution. As we move forward within this pandemic, we'll reassess depending on what happens in the future. But just wanted to let you all know this is not a permanent replacement for the on-site monitoring visits. But we kind of want to give you an idea of what we're looking at, maybe some minor differences. First of all, in the virtual site visit, obviously the FPOs will contact you. They'll be contacting you as the grantee. They're going to coordinate the VSR, provide you with the instructions, the expectations, logistics, and most importantly, I think, answer any questions that you might have. Versus the on-site monitoring visit, which I know many of you may have already participated in, new grantees, this is going to be something different for you. Typically, as you know, a federal project officer would come out and do an on-site visit. But in this particular case, we're moving to the virtual world. So just wanted to kind of give you an idea of how we're seeing the VSRs versus the actual on-site monitoring. Next slide, please. So we want to give you an idea here, and again, I know you'll all get these slides, but just kind of wanted to inform you of who really the key players are and the RHY staff. So as you can see here, we do have a Washington, D.C. Central office team. The program manager there is Chris Holloway. He was on earlier, obviously, and part of his team there in D.C. is Toyin, as you can see, and Gloria and Tiana being the newest member of the central office team. So there's their contact information, just to give you an idea of who the particular individuals are and what programs they coordinate, and actually what contracts they're the contracting official representative of as well. So it gives you an idea of our central office team there. Next slide, please. Here is the regional team, or what we call, the Team East, headed up by Keith Wallace, who you just saw there, and just kind of want to give you an idea of who the regions and then particular individuals within those regions. So, and I would encourage you that, you can direct message if you see them online in this format, you can actually send them a direct message and ask them questions in real time in this particular format. But you can see there, Region 1, see the territories, that's Jessica. Region 2, you can see Danny and Asita. Region 3, Andrea and Abiba. And of course, Region 4, Paul, Rebecca, and then Sharon Boyd, or Sherry Boyd, our newest member to our RHY team. Next slide, please. And then, of course, we have Team West, headed up by myself. And then you can see your federal project officers located in Region 8, Maya, Deb, Region 9, Angelica, Deb Oppenheim, and Katrina Winston. And of course, Region 10, you have your federal project officers of Tom and Janice. Next slide, please. And then Team Midwest, headed up by Aaron, who spoke to you earlier. You can see that we have the Region 4 Federal Project Officers, Alicia, Carolyn, and then we are pending one additional Federal Project Officer to onboard in Region 4 here shortly. Also Region 5, you can see Jenny and Nikki, and then we're also pending 2 additional Federal Project Officers to join Region 5, that team. And then, of course, Region 6, which is Rachel, who is also a new member, but has been with us for almost a little over a year, maybe longer, I believe, but wanted to let you know that who the project officers were. Next slide, please. And now I will bring in my colleagues for the Q&A. We have about 10 minutes left here. We may be able to go a little longer if we're able to, but I will bring them back on. And I will just ask to cue them back, and we'll get to the question and answers at this point.
All right, thanks, Jeff. Good to be back with everyone. We've been fielding some questions, preparing them as the presentation's gone on. So we're going to go back to Risa's presentation, and I've got a few questions for her, so forgive me as I'm looking off to the side of the screen here, reading these questions off. First off, Risa, Emily is asking, is it possible those 45% are active clients that have not yet exited the program? So this is obviously referencing some of the data that you were showing earlier.
So, thanks, Chris, and thanks, Emily, for that question. So in terms of looking at the data, and this is a trend we're seeing, I should mention that this was FY2018 data. We've seen similar trends with FY17, and we're seeing similar trends with FY19 data. But if we're looking at the safe destination, this is typically youth who are have exited or preparing to exit the program. So it could be a combination of few factors. So one of the issues that we're working with is, and we're doing a root cause in terms of the data. However, with that being said, we know that there are multiple places where we can get missing data. So it could be at the HMIS level in terms of extracting the data, and we're not getting, and that's why I think it's so critical to have you to ensure that your grant number is correct, and to make sure that when you're working with your HMIS lead, that they're extracting all of your data so that you're able to upload. I think for FY2018 data, we know we experienced some challenges at the upload period. So that's where we may, another opportunity to have some missing data. So I know that the 45%, or for TLP, the larger number of roughly about 58%, I think is high. I think it's a little bit overinflated, but I don't think significantly so. So I hope that answers Emily's question.
All right, great, thank you, Risa. The next question comes from Nicole. Nicole is asking, how does this data account for the maternity group home clients who stayed in the program at the end of the program period?
So I think for this, the safe destination, it's what we did was look at youth who have exited the program. For the permanent connections one, I think that could be a factor in terms of the larger number of missing data, because it could be that youth are still in the program, and because they haven't exited, you have not submitted those data yet. So I think over time, as we look for the entire year, when you're submitting all of your data, we want to make sure that we are capturing those who have exited, and make sure that with the analysis moving forward, that it's all of the youth who have exited the program. So we have a clear picture. But again, multiple areas for potential for where missing data can occur. And I should also say that over the years, we have not reached 100% of data submission from all grantees. We've gotten close in the past. I think over the last couple of years, we've seen those numbers drop. It used to be in the 90, I think 95, 96%. We've seen it drop as low as 77%, I believe. And now I think this year, with this year's data submission, it has significantly gone up. So Nicole, I do appreciate that point that you've made, but I think for the exit, I think that's a little bit more focused on the youth who have exited the program versus the permanent connections one.
All right. Next, we have a question from Kelly. Are these numbers only including discharged clients?
So yeah, so for the the safe and safe destination, yes. For the permanent connections, no.
Okay.
That's the dirty for that.
All right. Also from Bridget, we have, is the missing data due to the skipped RHY HMIS upload or active clients?
So as I mentioned, we do have several grantees who have not uploaded their data. And I know several of them have reached out to our contractor through the help desk for that support. For those that have experienced challenges, I will put a plug in that from 5 to 6 today. Our app associates team is there for anyone who wants to get a consultation with them in terms of any challenges that they're experiencing with their data upload. With that being said, because we don't have 100% participation rate at this point in time, it could be, again, for the safe destination, we're looking at youth who have exited. For the permanent connections to a positive adult, no.
All right, great. Sally is asking, is this annual data?
Yes, so what I presented was annual data for FY 2018. As 2019 data, we're still seeing a lot of missing data, and we're working through that to, again, look at what are some of the root causes of the missing data that we're seeing. Again, it could be at the HMIS level where it's not fully extracted. It could be at the upload period through the repository, and then it could be that youth have not, or just plain missing data.
Okay. So changing gears a little bit here, we've worked our way through the RHYMIS and data-related questions. Mina is asking, do we know how many years the TLP grants will be, 3 or 5? And so the answer to that, Mina, is that we are transitioning back to 5-year budget and project periods for the transitional living program and maternity group homes. We did, over the past 2 cycles, reduce that down to 3 years, but decision was made to go back to that 5-year budget and project period. And then Bridget asks if there was any chance the 3-year grants from 2019 will be extended to 5 years rather than going into competitive renewal in 2022. And the short answer is, Bridget, no. The grant awards that were released in 2019 will run their full cycle after 3 years. And those organizations with those funds or with those awards will need to reapply again in 2022. I'll turn a question here to Jeff, Keith, or Aaron briefly. How have the shelter services evolved with COVID? Congregate care is really challenging right now. Who would like to handle that?
I'll take it.
Keith? All right, Keith.
So, all right. So what we're seeing, many shelters have had to reduce their population by as much as 50% in order to ensure social distancing, especially in the bedroom areas. And, it's unfortunate, but we're also hearing from many shelters that they've seen a decrease in number of youth because they're afraid to come in congregate care facility in an unsafe situation, such as a home that's not safe, or they're on the street. So it's not been a good situation, but what we've seen is BCP programs have done a great job of overcoming many issues and trying to ensure the safety of both staff and youth, and serve as many youth as possible.
All right. So we just got a minute or so left here. I've got 1 or 2 more quick questions. One is, where can we obtain a site review protocol if one is available? Jeff, did you want to field that question?
Sure. So I'd say that the best resource there would be to contact your federal project officer, and they will work with you in providing you that that site review protocol as we move forward. I know that there's a lot of questions around the virtual site review, and they with you as a grantee as we move forward for those. So that's where I would refer to you.
Great, thanks, Jeff. And then we have one last question that we'll field, and I'll send this one back to Risa. With the new, and this is from Patrick. Patrick asks, with the new quarterly data upload, will there also be a corresponding written report quarterly?
So I'm not sure, if Patrick is referring to the data quality report, then I would say yes. I think we are working which report? Did you have any clarifying information?
I don't. My assumption here, Risa, is that Patrick is asking about the PPR, which in that case, we would not be changing to a quarterly PPR. That's
Correct.
A standard report for ACF. Yep.
Right. So the progress performance reports are still semi-annual. For the data upload that are quarterly, if he's asking about the data quality reports that come with each upload, then I would say yes, because that's the opportunity to look at your data to see where there's missing, and then the opportunity to make those changes and resubmit during the data upload period. Again, just knowing that your final data upload is what we're going to accept. So if you have gotten your data quality report and it says you're at 90%, and then you want to look at your data and then go back to your files and make some updates, you can resubmit again to try and get to 95, 98, 100%. But just know that your final data upload is what we typically accept. So I'm hoping that's helpful.
Great, thanks, Risa. And we have one more question that I'm going to throw to Aaron, and then we'll go ahead and wrap up our session today. John asks, will the maximum age limit for TLP youth be raised for the next cycle?
Well, no. Currently, it's going to remain the same for TLP, the 16 to 21.
Great. Thank you, Aaron. All right, so that is all of the questions that we have in the queue. I want to say thank you to Risa and Jeff and Aaron and Keith for their presentations. Thanks to all of you. We had well over 500 individuals participating in the session, so it was great that you stuck around for the entirety of our presentation. I've been asked by the RHYTAC team to let you know that we have networking by topic next on the agenda. So please head to the expo to contribute to the networking discussions. And these are discussions that are focused on the impact of COVID-19, shine a light on prevention, which is going to be facilitated by the staff from the National Runaway Safe Line. We have a networking session on authentic partnership with youth and young adults. We have a coordinated system response to reduce the risk of youth homelessness and building culturally responsive programs. And as Risa mentioned, there is a consultation with APT from 5 to 6 on the RHY HMIS, as well as APT has a booth in the Expo Center. So with that, we'll come to a close. Risa, any final comments you'd like to make?
Sure. And I'm not sure if it's in the hop-in chat, but just want to encourage everyone to fill out the evaluation for this session and to go ahead and submit it. So I'm assuming they've provided the link in the chat box for you to complete your evaluation for the session, because this really does inform the information we present to you each year. And so with that, I also want to say thank you to my colleagues for this presentation, but thank you to all of you for sticking through and the wonderful questions that you've asked. So with that, I will wish everyone a good evening. Thank you.
Thanks, everyone.